Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a beagle whom we are putting a esophagostomy tube, and I will show you how we put this esophagostomy tube in Cessna. We are using this Riles tube which is 14 number, and we can decrease or increase its size. These are available in Indian market very easily. Um, because this is not perfectly meant for the dogs or cats. We are using human products, so some modification always we try to do in these cases. Otherwise, sometimes it's difficult to put, and while putting, we get lots of troubleshooting. So avoid these troubleshootings. What we are doing, this tip is a, blunt tip here, round tip. Here we are putting a suture with you can use either 20 nylon or maybe 109 nylon, depending upon the size of tube or size of the animal you can use. And I'm keeping almost 5 to 6 inch of thread out, and then I'm putting two or three knots on this. And the knots I wanted to keep it towards the completely towards the cranial aspect, so that when we are pulling this, it comes directly. It should not stuck in between the tissues. In case if, because this is a longer tube, if we are using directly, after cutting this tube, cut end doesn't reach perfectly, comes through the tissue, sometimes stuck, and we get into trouble. So to avoid this, we are doing so. Just to measure the tube, there are some marks are there on the tube, and usually rather than putting marks with the marker, I just take these marks and just decide where to cut after putting one part of the tube. Once we cut it and then put in the a little later we will able to know that. But before that only we need to think of putting either a mark on that, or we can think, okay, this is here 1.60 160 centimeter length is there, so there above the 2 centimeter area I'm going to cut. And we have to measure it from the area in the esophagus where we have this tube is coming out, and in between 7 to 9th ribs we need to keep. So now what we are doing, we are using right angle forceps, and we are putting inside the mouth, and it has to go in the esophagus. Sometimes directly in the mouth we do, and then try to bring it out. It can create problem with the hyoid apparatus, or sometimes it can come out in the area where the pharynx are there, pharyngeal area is there, and that also sometimes leads to problems. Sometimes in cats that can lead to pneumo, air can accumulate under the skin. So this we are able to palpate it outside. My assistant is going to cut, and I'm pushing this right angle forceps towards the outer side so that it just popped out completely. Assistant has to cut minimum as possible, and just they can keep rubbing over that tip of the right angle. So right angle forceps has come. Here we have to make sure that we should not open this right angle too much. We have to open very little, maybe a 1 mm, and then try to put this thread inside. If you are putting it too much, if your opening is too much, sometimes while closing it, some mucosal tissue comes in between the forceps, create problem, and then we just pull it towards the mouth. You can say how easily it has come, but in case if you are using cut ends, sometimes they get stuck in this area. So now we have, before only we have measured it almost 2 centimeter above this 160 mark, we are cutting it. So I'm just going to cut it from here. Yeah, maybe 3 centimeter I'm taking, and that's all. And now we are going to reinsert into the esophagus. So some assistant has to hold it, and we need to open the mouth, make sure the orientation is better in good in this, and we try to put directly in the esophagus. The dog is under anesthesia, so under anesthesia only we can do this procedure. So we need to push it completely, and sometimes we can use our forceps or the right angle forceps to push it as much as possible inside. You can see that. Okay, and then we are pulling it back here, and we have decided that where this mark been given till that point, we are going to keep the tube out. So I don't have to put the mark, only those numbers are there. There only I just make sure that I put the keep the tube this much out. Now you can do a pursing suture on this, or usually what I do is I put two stitches. One is directly a continuous suture, directly a single suture, compressing the tube, and then another suture I'll put, and that I'll make it as a Chinese knot. And now we are going to put another suture, and then we'll put a Chinese knot on. In our hospital, we do this process very regularly. Almost every day we have one procedure average, and we use these are very useful procedures. And when the dog or cat is not eating food, in our hospital, in case if any admitted cat is not eating food more than 2 days, we highly recommend placing a tube so that you can avoid giving them too much drips. All the medications, hydrations, nutrition, everything can be given through the tube only. Because cat, they do get problem if they are not eating for 2 to 3 days. They get liver, fatty liver and all, and their appetite doesn't come. So to regenerate the liver, best thing is to give them food. So if they are not having any vomiting and all, this is the best way to take care. So we have put four throws of Chinese knot, and these tubes we can keep like 10-15 days longer. Even you can keep for months together also. You can just keep doing the complete dressing, keep it sterile from this area, and keep changing the sutures in case it get loosened sometimes. So this is how we use these Ryle's tube as a stomach tube, as a esophageal tube in